All right, we have 12:16. So folks, thanks for joining us this afternoon. We are going to brief you on our decision to require COVID-19 vaccinations for all of our team members. We have with us today Mr. Bob Riney. He is our President of Healthcare Operations and Chief Operating Officer, and Dr. Dennis Cunningham. He is our System Director of Infection Control and Prevention. And I'll go ahead and hand it over to Bob.
Thank you, Dana, and good afternoon, everyone. I'm pleased to be joined on this briefing by Dr. Dennis Cunningham, who's our System Director of Infection Control and Prevention. He's also a practicing pediatrician and has been part of our Vaccine Incident Command team and a leading voice in vaccine education and community outreach. I want to begin by saying how proud I am of the courage and dedication the entire Henry Ford Health System team has demonstrated since the beginning of this pandemic. We have protected each other, relied on each other, and supported each other every step of the way. And because of that, we have emerged stronger together. With COVID-19 hospitalizations in the single digits at each of our hospitals and the positivity rate now hovering at about 1%, we're optimistic that the worst is behind us. But we have lived this fight long enough to know that the new variants are real and worrisome, and they will continue to emerge, and surges can happen anytime, anywhere. As the data and science continues to reinforce the safety and effectiveness of vaccination, and with the expectation that the FDA will grant permanent approval to Pfizer and other vaccines soon, we have made the decision to mandate the COVID-19 vaccination for all team members no later than September 10th, 2021. To be considered vaccinated under this new mandate, our team members must have had both doses of the Moderna or Pfizer vaccines or a single dose of the Johnson & Johnson vaccine. This applies to all team members, medical staff, students, volunteers, and contractors that do business on our facilities and in our facilities, including employees who work remotely or those that have had COVID-19. Vaccination will be a condition of employment in the same way that we have with the annual flu shot. Exemptions will be granted for those who qualify for medical or religious reasons, which is also what we do for the flu shot. We believe that we are the first healthcare system in Michigan to mandate vaccination. Nationally, we are aware that over 18 healthcare systems are requiring or in the process of requiring vaccination for their employees, and we anticipate that that number will continue to grow. As a leading and trusted healthcare organization, our patients and our customers expect and deserve that we take every possible measure to create a safe and trusted environment in which they receive care. We did not make this decision lightly, but we are confident that this decision is right for us and it's right now. As members of the broader healthcare family, we have a responsibility to lead by example, instilling trust and confidence in our communities by stepping up, being vaccinated, and educating our friends, families, and neighbors about the safety and the effectiveness and the necessity of vaccines. With all the advancements we've made throughout this pandemic, we believe vaccination remains our best path forward, and we have consistently advocated for that. As many of you know, I've spoken passionately in this forum and elsewhere about the importance of vaccinations. For that to truly make a deep and lasting impact on the pandemic, we simply need everyone in this fight. With that, I'll turn it over to Dr. Cunningham.
Thank you, sir. Hi, everybody. As the System Medical Director for Infection Control and Prevention, my job is to ensure that as a healthcare system, we do everything possible to protect the health and safety of our team members, our patients, our visitors, and our customers. There is no question in my mind that every person who walks through our doors will find some comfort knowing that their team care providers and everyone they come in contact with are vaccinated against COVID-19. Compassion is one of the core values of Henry Ford. It's a promise to provide a heartfelt experience to every patient, to every team member, and to each other. There's no greater compassion we can show each other right now as a group of healthcare workers than to be vigilant about safety and preventing the spread of this devastating disease by being vaccinated. Our decision to require vaccination for COVID is consistent with existing policy at Henry Ford. Flu shots are required every year, and team members are required to stay current with other vaccinations like measles, mumps and rubella, and whooping cough. Since vaccination started at Henry Ford December 17th of 2020, our current vaccination rate across the health system is 68%, or just over 23,000 team members. In Michigan, as of yesterday, 61.4% of the population 60 and older has received at least one dose of a COVID vaccine, and 51.3% are fully vaccinated. Right now, we are seeing a higher vaccination rate among our clinical teams, particularly our physicians and frontline staff, which may not be surprising as they bore the brunt of COVID in the healthcare system. Over 90% of our physicians are vaccinated at this time, which matches the national trend shared in a survey by the American Medical Association. Currently, our average frontline staff is around 70% vaccinated. Like other healthcare systems, we're seeing lower numbers among non-clinical administrative teams. We suspect that part of the reason for this might be that so many of our non-clinical teams are still working remotely and are choosing to wait to get their vaccines. As Bob mentioned earlier, the safety and efficacy of the vaccines has been proven by science. We also know that the hospitalization and death from COVID is preventable by vaccination. These days, most people being hospitalized or dying from COVID are the unvaccinated. This is tragic and completely preventable. For team members planning for the 2-dose vaccine with Pfizer or Moderna, we would like them to receive their first dose of vaccine no later than August 10th so that we can make sure they have their second dose by September 10th, which is our deadline. For those who have a health condition that would make vaccination risky, they should consult with their physician. For women who are pregnant, we know from studies that the vaccine is safe and may offer some protection for their babies. But if the pregnant woman chooses to wait, she can receive the vaccine after delivery by submitting a request for medical exemptions. In closing, we believe safety and infection prevention are everyone's responsibility. I've been a strong advocate for vaccination since these vaccines received emergency authorization from the Food and Drug Administration. I participated in numerous virtual vaccine outreach efforts to talk about the safety and efficacy of these vaccines and dispel some of the wildly misinformation that circulates online and elsewhere. I've spoken to our own team members and to a variety of our community partners and community groups. In an employee webinar earlier this month, I was joined by my son who received his vaccination and as a part of discussion about vaccines in young people. So far, more than 130 million people in this country are fully vaccinated against this virus. That's a powerful and convincing message. And with that, I'm going to turn it back over to Bob.
Thank you, Dennis, and we will now welcome your questions.
All right, folks, I have several in the queue, so we're going to go ahead and start with Rod Maloney. Folks, if you could introduce yourself, your name and your outlet, please.
Yeah, hi, good. Rod Maloney, Channel 4 News, Detroit. Bob, can you talk about the protocols here that are involved? That you've given us the dates as to when people should be vaccinated, but what happens if you don't? And are you expecting there to be protests like we have seen in other places with similar decisions like this?
So we know that not everyone will agree with this decision, and our goal is to do what we've always done, which is to communicate in a very frank and transparent manner with our team members, make sure that we are providing all the support so that they understand the rationale behind the decision and dispelling any concerns that they may have themselves. So we don't anticipate that we will have that type of a reaction because we plan on making sure that we're connecting with people. Having said that, we want to make sure that we are being extremely thoughtful in our communication approach and that we are working to make sure that everyone has all the information that they need. At the end of the day, there may be some individuals that will choose not to be vaccinated and choose to leave employment at Henry Ford Health System, but we don't anticipate that number will be very large, and we certainly are going to do everything we can to mitigate it.
How will you go about the business of making sure you get your deadline is September 1? If you don't have your vaccination by September 1, does that mean you're terminated, or how does that process work?
We are going to work with all individuals to make sure that they have ample access to being vaccinated, and make sure that it is very easy at many of our facilities, and work towards getting as much compliance as we absolutely can. At the end of the day, though, we have established a deadline that would require this as a condition of employment, and that is September 10th. There are exceptions, as noted, for religious purposes and for certain health conditions, and we currently have those in place with the flu. I know there was a question in the chat room about what percentage of team members currently get exemptions from influenza vaccine. And Dennis, I know that number is very low. It's around 500, if I remember correctly, but please.
I believe it is less than 1%.
Yeah.
Okay, thanks everybody. Thanks, Bob. Thanks, Dennis. Okay, I have Julie Mack, then Kim Craig, then Kate Wells, then Kristen Seamus. Julie, go ahead and open your mic and ask your question.
Hi, actually, I was the one who asked about the percentage of team members, but I have a second question. And that is, what if someone says, hey, I have natural immunity, you can, I've got the antibodies to prove that, and I don't want to be vaccinated for that reason. Are you accepting natural immunity as a reason for an exemption?
No, we are not. And there's a couple reasons for that. There's some data that suggests the protection from the vaccines is longer acting than natural infection. We know that the vaccines, such as Pfizer, are pretty good against some of the variants, including the Delta variant. It's not been established yet that natural immunity to COVID will also protect you against Delta. So we're following the recommendations of the Center for Disease Control and Prevention and other professional medical societies that it's really best to get the vaccine.
Thanks, Dennis. Kim Craig, you're next.
Hi, folks. Kim Craig, Channel 7. Given that this is a condition of one's employment now, have you gotten any pushback from any of your unions that you potentially see a challenge from?
We will work with any and all of our team members, including those that are represented, to make sure that there's complete, open, and transparent communication. I'm sure that we will have some level of resistance or pushback, but ultimately we will work through those issues as we always have.
Thanks, Bob. Kate Wells.
Yeah, thanks for taking my question, Dana. I'm so sorry to be that person. Bob, can I just ask a clarification on your answer? I think it was to Rod. So with that September 10th deadline, is that like the drop deadline? If they don't have the exemption filed or the full vaccine by the 10th, they're filed?
Yes, it is.
Okay. My actual question, if you don't mind, is essentially with these exemptions, with the medical and valid religious exemptions, what would you say to critics who say, look, those exemptions are large enough to basically drive a truck through, that I can say there's any kind of religious reason I'm not getting this?
So I can address that. As far as medical exemptions, there's very few reasons to not get the vaccine. It's really if you've had an allergic reaction to the first COVID vaccine, or we know that you have a serious allergy to one of the ingredients in the vaccines. The religious exemptions, it has to be something that you've demonstrated that if you've had other types of vaccines before, you can't say that I have a religious objection to the vaccine. It's something that we go through. As I said, for flu, we've encountered the same resistance. Again, very small number of employees, less than 1%, wind up getting a medical or religious exemption. I would expect that the rates are going to be similar for the COVID vaccines.
Very good, Kristen Seamus, and then Deanna Lights. I know you're listening, and I do see your question in the chat. I'll ask it after Kristen's. Kristen, go ahead.
Hi, Hi, thanks so much for taking my question. Could you detail for us how many employees the health system currently has and how many students and volunteers are currently working with Henry Ford Health System?
We have, Kristen, we have 33,000 team members. Several thousand of those are contingents, or what you may consider to be kind of transitional workers, but 33,000 in total. In addition, we have about 3,000 students at any given time in either our allied health or our medical programs.
Thank you very much. Deanna wants to know, why wasn't the vaccine mandatory from the start, since we already had a vaccine policy in place?
Well, if you remember, when the vaccine first came out, the supply was very limited. It takes time for the factories to start manufacturing the vaccine in large amounts. So at Henry Ford, we prioritized it for our frontline healthcare workers. We then prioritized the people at highest risk, those who are above a certain age, underlying immune problems. So it's been relatively recent that there's been such a great supply, that we have more supply than demand. So it wasn't that we wouldn't have done this earlier. We had to also think what we could do. We wanted to make sure vaccines were going to those who were at the highest risk before we opened it to others.
Thank you, Dennis. Folks, that's everybody on my list. If you have any follow-up questions, go ahead and raise your hand or send me a message in the chat. I do see some hands that may be still raised. Rod or Kim, did you have follow-ups?
No, I'm good, thank you.
Okay. And Kim?
Sorry, Rod. Yeah, just real quick, if, and I apologize, I didn't lower my hand there.
It's quite all right.
Somebody, just for clarification, I think, just to make sure I understand it, if somebody is working remotely, somebody can't say, well, I want to stay working remotely, so I don't have to get the vaccine. Even if you work remotely, you still have to get the vaccine, correct?
Correct.
Okay, thank you much.
We need all our team members able to work. And even if you're not at the hospital physically, there's many people doing important work from home. We want to make sure that they're healthy and able to help support our operations. We really take seriously our role in treating the people in our community and across the state. And we want to make sure that we have a full team of healthy people so that we can continue to meet that expectation.
And I might add that, there's no question that this will evoke various reactions from people. But, at the end of the day, as a leading health system that's helped navigate this community through 3 major surges and just dealt with so much heartbreak and loss, we want to do everything we can to role model, lead the way, and encourage, because we don't want to be back here in the fall with an emerging Delta variant or another variant. There's just so many reasons that we all have to work as a team at this point.
Thanks, Bob. Julie Mack, I see you have another question. Go ahead.
I do. So Dr. Cunningham, this is for you. At this, the numbers have been plummeting like a stone. This is a more general question, but do you think they're going to go lower? At what point do you expect we hit bottom? And, what do you see as being when they could rise again, perhaps the fall, or what? So what do you think about the numbers going forward?
I'm very happy the numbers are going down. I can tell you from other countries that have had higher rates of vaccination, you really start getting the virus under control when around 60% of the population is vaccinated. When you can get to 70% of the population, it's really under great control. And we're not yet there to 70% in the state fully vaccinated. It's a very unpredictable virus. Mutations happen very quickly. There's always new and emergent variants. Right now, the vaccines are protecting against all those variants. So I'm cautiously optimistic. I'm feeling the most optimistic about COVID that I have since this pandemic started. But as Bob alluded to, we could very well have another surge, whether it's in the fall, whether it's in late summer, I don't know, but we want to make sure that we're prepared.
Dennis, you say folks, I do see a couple more questions from Kim and from Karen Buffard. But Dennis, you said you're feeling very optimistic, but I personally take my mask lead from you. So you're fully vaccinated. You go into the grocery store. What are you doing in terms of wearing a mask?
I have not been wearing it at the grocery store. I have a good immune system. I've had 2 doses of the vaccine. I feel very comfortable that I'm being protected. The science is incredible. If I see people at the grocery store who look sick and they're coughing, that mask is in my pocket and goes right on my face. The masks do work. I know people wonder about that, but look how many flu cases we had last year. 3 confirmed cases of flu in the entire state. And it is not because people aren't testing for it. When Henry Ford tests for COVID, our platforms also test for influenza, and we just didn't see it. So those who may not respond to the vaccine for various medical reasons, the masks are a great solution.
Thank you for that. It's very comforting. I do have a comment in the chat from Dr. Peter Watson, who is our colleague at HAP, and he's saying that he thinks it's incredibly important to reiterate that even with the folks who have had past COVID infection, they still need to be vaccinated. So Dennis, do you want to reiterate that on Dr. Watson's behalf in your own words?
Absolutely, I agree with him completely. We don't know that if you've been infected in the past, we don't know if you're going to have cross protection against some of the newer variants. We do know that the vaccine protection does provide protection. Again, the Pfizer vaccine, we're talking 82 to 89% protection against the Delta variant. It's not 95%, but that's still a very effective vaccine. So I really encourage everyone to get the vaccine unless you have a true medical reason that you can't.
Thank you very much. Okay, so Karen put her hand down, so I still have Kim Craig on my list. And then if anybody else has any questions for us, go ahead and put those in the queue or raise your hand. Rod, I still see your hand up, so I'm not going to call on you unless I hear from you. Otherwise, we're going to start wrapping things up. So Kim Craig, go ahead and ask your question.
Yeah, just real quick. I assume the mask policy is going to remain in effect in all your health facilities. Is that the case? And does it make a difference in certain office areas if the staff is at that point will be fully vaccinated after September 10th?
So we are required by the CDC and the Michigan Occupational Safety and Health Administration to continue to wear masks, employees, visitors, patients when they can. So that has not been lifted, that emergency order. We will continue to wear the masks regardless of vaccination status in the clinical areas. In areas that aren't providing patient care, in my office, I'm not going to wear the mask since I'm vaccinated, and we have a detailed policy. We're putting that out for people who are vaccinated. There are times you can take your mask off, but anyone who wants to wear a mask, regardless of where they are, that's fine as well.
Thank you very much. All right, folks, if you have another question, go ahead and open up your mic and have at it. Otherwise, Bob and Dennis, I defer to you to any closing comments.
I just thank you all for your time and attention and your communication on these very important issues related to the vaccine. We have an absolutely wonderful workforce. You saw them at their finest through the entire pandemic, and we want to make sure that they're safe and protected, and we want to make sure that everyone that comes into any Henry Ford health system knows that we are leading the way. So thank you very much.
I will say I feel incredibly fortunate to work at such an organization with incredible team members and leadership that we not only want to do what's right, but we also want to be an example. So I am 100% behind this mandate. I think it is the right thing to do scientifically, and I'm happy to be part of it.
Hear, hear. Thank you, Bob and Dennis, for your leadership and for your time today. And to our friends in the media, thanks for joining us. And hopefully we'll see you next time for something really exciting and positive and un-COVID related. Take care.